The study of plague and pestilences remain as relevant today as it did in pre-industrial Europe, as we struggle to combat the threat of epidemic disease from SARS and Ebola to COVID-19. Many of the public health measures developed in Renaissance Europe, such as quarantine and isolation, provide the model for contemporary government policies, just as human reactions of fear and panic are shared across the centuries. This course will be framed by plague, analysing the strategies adopted by governments to cope with its impact on society, from the Black Death in the middle of the 14th century to the Great Plague of London in 1665. In order to understand the complexity of society's mechanisms to deal with the threat of epidemic disease, it will be argued that it's necessary to examine contemporary understanding and the treatment of endemic disease. The majority of classes will therefore focus on the range of options available to someone in pre-industrial society to maintain their health and to treat sickness, whether it was fevers, the great pox, or broken bones. Emphasis will be placed on patients who will be seen as active rather than passive agents, whether in seeking to treat themselves through domestic remedies, consulting licensed and unlicensed practitioners, attending their local hospital, going on pilgrimage to miracle shrines. These systems of healing will be analysed through a wide range of written and visual sources, including medical treatises, records of hospitals and medical colleges, cases against practitioners, collections of medical recipes and diaries, and letter collections. Evidence will be drawn from across Europe, with the main emphasis on Italy and England, two countries with very different economic, political, and religious characters, but linked through English admiration for Italian models of healthcare.